Our Chief Health Editor, Dr. Partha Nandi, joining us now. Good afternoon, Dr. Nandi. We're talking about that new information from the CDC, vaccines and teachers, and new information about one vaccine and how it could substantially reduce the spread of COVID-19.
Yeah, good afternoon, Linda. I'm excited to share this news because, as you know, there are only 2 approved vaccines in the U.S. for COVID-19, and both of them have really great high efficacy rates, but they have not been, and I'll repeat, not been shown to stop community spread of this incredibly contagious virus. So that's why this research to me is big news in the scientific world. Now, AstraZeneca's vaccine, we know, was developed by England's Oxford University, and in their trials, Linda, participants were regularly tested with nasal swabs to see if they'd become infected with the coronavirus. And let me point out that no other large-scale human trials had done that, and participants were only tested if they developed symptoms. So regular testing in the AstraZeneca trials found that there was a 67% reduction in positive tests overall in the participants who received the first vaccine. It went down to 50% after the second dose was given, but it was a landmark result because it had not been done before.
So, Dr. Nandi, did AstraZeneca trace contacts of those in the trial and people close to those participants? Did they get infected or no?
So, Glenn, they did not do any contact tracing. However, the Oxford researchers said this: if the vaccine was just making infections milder, then the positivity rate would not change. And that's kind of their assumption. Having said that, though, we really need more definitive research before we confirm that the AstraZeneca vaccine would indeed stop people from passing the infection to others.
Okay, so let's talk now about the vaccine, stopping symptomatic disease, those who were vaccinated. What was AstraZeneca's efficacy rate and why did it change?
And this is kind of, what Moderna and Pfizer did. So AstraZeneca's earlier results showed that the vaccine had an estimated 70.4 efficacy rate, but that number now has jumped to 76%. That's because the new analysis now shows that they've had more trial sites plus another month of data. Now, the 76% protection rate, Glenda, started at day 22 after the first shot, so roughly 3 weeks, and lasted up until the next dose 90 days later. But that rate changed again when the doses were spaced out. So when the participants got their second dose about 12 weeks later, then the efficacy rate actually rose to 82.4, which is really fantastic in my opinion.
So AstraZeneca's vaccine has already been authorized, countries like the UK and India. So we're still waiting on results of that phase 3 trial. Why is that, and when do you think we'll hear more?
So, Linda, AstraZeneca just finished enrollment, right, in their phase 3 trial just last month. So I don't expect them to get any authorization until late March if everything goes well. But I want to emphasize this: I don't want people to wait until this vaccine's approved. If you can get the Pfizer or Moderna vaccine, please get it so we can put an end to this whole crisis with coronavirus. If you can get the vaccine now, please get it. But we'll get more data, especially on this community spread, because that could really be a game changer for us.
All right, Dr. Nandi, more encouraging news this afternoon, and we certainly appreciate it and need it. Thank you.
My pleasure. Thanks, Linda.
If you have a coronavirus question for the good doctor, email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or Twitter, and we'll get it right to him. Alan.